Did you know that you can easily make a difference in patient care and safety? 1 in 9 adult visits to the emergency department are because of an adverse drug event, and 1 in 3 of those visits for adverse drug events are because the patients were put back on a medication that previously caused harm. Repeat adverse drug events occur partially because information systems don't connect very well across health sectors, and patients' adverse drug event information can't be shared easily between healthcare providers. Take 78-year-old Sarah's story, for example. Sarah visited the emergency department because she had been feeling weakness and dizziness for a few days and was afraid to leave her house. Sarah was found to have hyponatremia, an abnormally low level of sodium in the blood. A pharmacist in the emergency department reviewed Sarah's medications and identified that a recently prescribed medication for treating high blood pressure, hydrochlorothiazide, was likely to have caused Sarah's symptoms. This is a type of adverse drug event. After treatment, Sarah was taken off the drug that had caused the problem and discharged back into the care of her family doctor. Sarah mentioned the episode to her family doctor, but she did not remember the details very well, nor did Sarah's doctor have access to the hospital's medical record. This left Sarah's family doctor and community pharmacist guessing as to which medication caused a problem and uncertain of the nature of her reaction. Since Sarah needed treatment for her high blood pressure, her family doctor followed standard guidelines and re-prescribed the same medication, which her community pharmacist re-dispensed. Sarah was soon back in the emergency department, facing the exact same scenario. Repeat adverse drug events are preventable, but because of gaps in communication, community-based providers, including pharmacists, are at risk of making decisions without a complete picture. Thankfully, researchers from UBC and SFU worked with the British Columbia Ministry of Health and clinicians to develop ActionADE. ActionADE allows clinicians to rapidly document adverse drug event information in a few key strokes. Because it is integrated with PharmaNet, BC's central medication dispensing database, the two systems can exchange information. ActionADE sends the adverse drug event information to PharmaNet. So anyone with access to PharmaNet who is part of the patient's circle of care will be able to see the documented adverse drug event information. Community pharmacists will then receive a patient-specific alert if they try to redispense the same medication or medication of the same class as the one which caused harm. Let's make sure patients are not harmed twice. Together we can prevent adverse drug events and make a difference in patient care and safety. To learn more, please visit actionade.org.